Good evening, everyone. I am presenting the causes of blindness and visual impairment among children. Introduction is children are the future and hope of mankind. Statistics reveals that over 12 million people who live in the country are visually handicapped. Prevalence of blindness is high in states like Madhya Pradesh and Rajasthan and other states like UP, Andhra Pradesh and Maharashtra. The number of blind children in the world was 1.5 million in 1990, which reduced to 1.4 million in 2015. It is estimated that at least 2 lakh to 3 lakh children in India have severe visual impairment or blindness. Although this represents a small percentage of the estimated 5 million blind in India, it is significant in terms of blind years. This is retrospective cross-sectional study at Tertiary Care Center based on record-based data of last 5 years of children having blindness at Tertiary Care Center. Total number of cases is 2 to 7 and the inclusion criteria is age between the 1 to 15 years and the presence of visual disability certification. And the results are the maximum number of the cases is present between the 12 to 15 year age group, which is 123, and the minimum number of cases is present between the age group of 3 to 5 year and which is 15. According to sex, maximum number of cases are males 151 and the females are 76. According to residents in rural area around 70% and in urban area around 30%. According to religion is Hindu is 83% and the Muslims around 16%. On the basis of cause, congenital causes are around 80% and the acquired causes are around 20%. In congenital causes, maximum number of cases are due to iridofuntal coloboma, followed by pathological myopia and congenital glaucoma, hereditary optic atrophy, and corneal opacity. And the few cases are also due to the congenital toxoplasmosis, Lawrence-Small-Biddle syndrome, and hereditary vitreoretinopathy. In acquired causes, maximum number of cases are due to refractive error and the trauma, and others are also due to deficiency of vitamin A, chemical injury, retinopathy or prematurity. In avoidable causes, maximum number of the cases which we can avoid are included in trauma and retinopathy or prematurity and due to vitamin A deficiency. In discussion, in our study, maximum 16% were due to iridofuntal coloboma, followed by 12% were due to thiazical and 8% by pathological myopia, 8% by chorioretinal degeneration and corneal opacity, whereas minimum by hereditary vitreoretinopathy, followed by Coats disease, Sturge-Weber syndrome, congenital toxoplasmosis. As per acquired causes of blindness, maximum were due to trauma, followed by refractive error, and the minimum cases are due to chemical injury and followed by the retinopathy of prematurity.
Please wind up.
Conclusion. Childhood blindness is predominantly found in 12 to 15 year age group associated with the malpreponderance. Congenital causes were abundant. Almost 20% cases were blind due to avoidable causes. The study emphasized the need for screening of blindness in early childhood. Our result highlight the importance of early diagnosis for prevention of childhood blindness. Thank you.
So the first point I'd like to make is that we have marks for slides, whereas this was a scrolling Word document. Is there a specific reason for that?
I think time is short, so.
I hope my co-judges take that into account. Secondly, you have mentioned various congenital and acquired causes. Whenever it is, you have such a long list, it is better to present them as in the form of a diagram or a bar graph or a percentage that is visually understandable. Okay, that would be one comment. And what was the setting in which this study was performed? I mean, the clinical setting. Is it an urban hospital, a rural hospital, a referral center?
At the Tertiary Care Center, SPMC Bikaner, PBM Eye Hospital.
Urban eye hospital.